I need to start this video with an apology. Not a personal one, but one on behalf of my entire profession. Because for decades, doctors like me have been telling patients to watch for the classic signs of diabetes: excessive thirst, frequent urination, blurry vision, and we have been leaving out some of the most important warning signals that show up long before any of those textbook symptoms ever appear. And here is what makes this truly frustrating. The people who needed that information the most were sitting right across from us in the exam room, and we sent them home without it. So today, I am going to fix that. I am going to tell you about 5 symptoms of type 2 diabetes that almost nobody talks about, symptoms that millions of people are experiencing right now and dismissing as stress, aging, or just having a bad week. These are the signals your body has been sending you for months, maybe even years, that your blood sugar is quietly doing damage while you go on with your life completely unaware. Let me be honest with you from the very beginning. Type 2 diabetes does not appear out of nowhere. It builds slowly, silently over time, and the body sends out warning messages all along the way. The problem is that those messages do not look like what we were taught to expect. They do not look like diabetes. They look like tiredness. They look like getting older. They look like needing a little more sleep or feeling a little more anxious than usual. And because they look so ordinary, people wait. They brush them off. And by the time the classic symptoms arrive, the disease has already had years to take hold and cause real damage. I see this every single week in my practice. A patient comes in for something unrelated, maybe knee pain or a skin issue, and when we run a full panel, there it is. The numbers tell a story the body had been trying to tell for a long time. And almost every time, when I explain what those numbers mean and what the early signs look like, the patient looks at me and says, "Why did no one ever tell me that?" That question stays with me. It is the reason I am making this video. Before I go any further, I want to ask you something directly. How many of the symptoms I'm about to describe do you think you might already be experiencing without knowing they could be connected to blood sugar? Think about that as we go through this, and when we are done, leave me a number in the comments, anywhere from 0 to 5, telling me how many of these match what you have been feeling. I read those comments. I want to know where you are. And if you are watching this channel for the first time and you want a doctor who is going to give you the real information without the filter, the kind of information that often gets left out of the 15-minute appointment, then please subscribe right now. I share something new here every week, and I would hate for you to miss it. Let me explain something about how blood sugar works in your body before we get into the symptoms, because understanding the mechanism makes everything else make sense. When you eat something, your body breaks it down into glucose, which is a form of sugar that your cells use for fuel. The hormone that manages this whole process is insulin. Think of insulin as the key that unlocks the door of your cells, so glucose can get inside. In a healthy body, this happens smoothly. You eat, your pancreas releases insulin, the cells open up, glucose goes in, and your blood sugar levels stay balanced. In type 2 diabetes, or in the years leading up to it, something called insulin resistance develops. The cells start ignoring the key. They stop responding to insulin the way they should, so the glucose has nowhere to go, it stays in the bloodstream. Your pancreas, trying to compensate, pumps out more and more insulin, and for a while it manages to keep blood sugar levels looking somewhat normal on standard tests. But behind the scenes, something called chronic low-grade inflammation is building. Your blood vessels are being slowly damaged, your organs are working overtime, and your body is sending out signals that something is very wrong. A landmark study published in The Lancet in 2012, which followed over 10,000 participants for more than a decade, found that blood sugar dysregulation begins an average of 12 years before a formal diabetes diagnosis. 12 years. That means most people walking around today with a clean bill of health could already be in the early stages of this process and have no idea, because the symptoms at this stage do not match the textbook description. They match something much more subtle and much more personal. And those are exactly the 5 things I'm going to walk you through right now. The first one is something I call the afternoon crash that no one can explain. You have probably felt it. It is around 2 or 3 in the afternoon, and suddenly you feel like someone turned off a switch inside you. Your energy disappears. Your concentration falls apart. Some people describe it as feeling like they could lie down on the floor and sleep for an hour. And most people blame it on not sleeping well, on their job being stressful, on just getting older. But here is what is really happening in many of these cases. When insulin resistance is developing, your body has trouble processing glucose efficiently after meals. So after you eat lunch, instead of your cells absorbing that fuel steadily and keeping your energy stable, there's a spike in blood sugar followed by a steep drop. That drop is what you feel as the crash. Your brain, which runs almost entirely on glucose, feels that drop faster and harder than any other organ in your body. I need you to listen to this message very carefully, because what I'm about to reveal could protect your health and perhaps even save your life. For a long time, I didn't realize the danger that excess blood sugar represented. I discovered that high glucose levels can increase the risk of heart attack, stroke, vision loss, and even amputations. The scariest thing is that type 2 diabetes often acts silently. Many people believe everything is fine when, in fact, their bodies are already suffering serious damage. And if your blood sugar is high right now, you may be at much greater risk than you imagine. But then I discovered a completely natural method that helped me understand how to balance my blood sugar levels and regain my quality of life. Thousands of people are also discovering this simple method and learning how to naturally reduce excess sugar and avoid the dangers of type 2 diabetes. And there's something important you need to know. All this information is compiled in a special video that we don't know how long will be available. If you want to discover what I discovered and learn a natural way to help control your blood sugar levels, click the link in the first pinned comment now and watch the video before it's taken down. It responds by triggering fatigue, difficulty concentrating, irritability, and sometimes a craving for something sweet or starchy that will bring the sugar back up quickly. This cycle, spike then crash, then craving, then spike again, is one of the earliest and most reliable signs that something is going wrong with blood sugar regulation. A study published in Nature Metabolism in 2020, which monitored blood glucose responses in over 1,000 adults using continuous glucose monitors, found that people who experienced significant afternoon energy dips were far more likely to have impaired glucose regulation than those who maintained steady energy throughout the day. The participants who had these crashes were also much more likely to develop markers of metabolic dysfunction within the following 2 years. This is not just tiredness. This is your body telling you something important, and it has nothing to do with how hard your week was. The second symptom is one that surprises almost every patient I mention it to, and that is tingling or numbness in the hands and feet. Now, most people hear tingling in the hands and think they slept on their arm wrong, or they have been typing too much, or maybe their circulation is just not great. And sometimes those explanations are correct. But when the tingling is recurring, when it happens without an obvious physical cause, when it shows up in the feet especially, this can be one of the earliest signs of something called peripheral neuropathy, which is nerve damage caused by elevated blood sugar. Here is how it works. When blood sugar stays elevated, even at levels that do not yet meet the threshold for a diabetes diagnosis, the excess glucose in the bloodstream begins to damage the tiny blood vessels that supply nerves throughout the body. The nerves that are farthest from the heart, the ones in the feet and hands, are the first to feel this loss of blood supply. They begin to malfunction. Some people feel tingling, some feel burning. Some feel a strange numbness like wearing a sock that is not there. This is called diabetic peripheral neuropathy, and studies have consistently shown that it can begin developing during what is called the pre-diabetes stage, which is before blood sugar levels are officially high enough for a diabetes diagnosis. Research published in Diabetes Care, one of the most respected journals in endocrinology, found that up to 50% of people with prediabetes already show signs of peripheral neuropathy when examined carefully. 50%. That means half the people who have not yet been told they have diabetes are already experiencing nerve changes. If you have been noticing tingling or numbness in your feet that comes and goes, please do not ignore that. That symptom deserves a real conversation with your doctor and a blood sugar test. Not tomorrow, soon. The third hidden symptom is one that I think is the most overlooked and the most emotionally damaging, and that is sudden and unexplained changes in mood, particularly anxiety, irritability, or a persistent low mood that you cannot shake. I have had patients tell me they thought they were developing depression. Some of them were already on antidepressants when we discovered their blood sugar was significantly dysregulated. And when we addressed the metabolic issue, the mood improved dramatically without any change in their psychiatric medications. Let me tell you about a patient I will call Margaret. She was 53 years old, a school teacher, very active, eating what she believed was a healthy diet. She came to me because she had been feeling anxious and irritable for about 18 months. She was snapping at her husband, having trouble sleeping, and feeling a kind of low-grade dread that she could not explain. Her previous doctor had diagnosed her with generalized anxiety disorder. When I ran her blood work, her fasting glucose was elevated, her hemoglobin A1C was in the pre-diabetic range, and her insulin levels were significantly above normal. We put her on a targeted nutrition and lifestyle plan. Within 6 weeks, she told me she felt like herself again for the first time in over a year. Now, I am not saying every case of anxiety or depression is a blood sugar problem. That would be an oversimplification. But I am saying that blood sugar dysregulation causes very real neurological effects. When glucose levels are unstable, the brain experiences that instability directly. Mood swings, irritability, brain fog, difficulty handling stress, and a generalized sense of unease are all consistent with the kind of glucose variability that happens in the early stages of insulin resistance. A study published in Psychoneuroendocrinology in 2019 found that participants with higher glucose variability, meaning more frequent spikes and drops throughout the day, scored significantly higher on measures of anxiety and emotional instability than those with stable blood sugar. Your mood is not separate from your metabolism. They are deeply connected. And if you have been feeling unlike yourself emotionally and cannot find a clear reason why, your blood sugar is one of the first things that deserves to be checked. The fourth symptom is one that most people would never in a million years connect to diabetes, and that is slow healing cuts, bruises, or persistent skin changes. You may have noticed that a small cut on your hand takes longer than it used to before it fully closes. Or a bruise that should have faded in a week is still visible 3 weeks later. Or maybe you have noticed small dark patches of skin developing in the folds of your neck, your armpits, or your groin. That last one is called acanthosis nigricans, and it is one of the clearest visible signs that insulin levels in the body are chronically elevated. When blood sugar is persistently high, it impairs the function of the immune cells that are responsible for wound healing, reduces blood flow to the skin through microvascular damage, and creates an environment where the skin struggles to repair itself efficiently. This is not cosmetic. This is a systemic sign that the body is under metabolic stress. The slow healing of wounds is actually one of the criteria that clinicians use to assess the severity of diabetes in more advanced stages. But the process begins long before it gets to that point. Even in the early stages of insulin resistance, studies show measurable delays in wound healing compared to people with normal insulin sensitivity. The dark patches, if you have them, are caused by the skin responding to high insulin levels by producing excess pigment in certain areas. This is your skin literally showing you what your blood work cannot yet confirm. And I want to be honest with you, a lot of people who have these patches have been told by other doctors that it is just a cosmetic issue, that it is about hygiene or weight. That explanation does a disservice to a very clear biological signal. If you have those patches, especially in combination with any of the other symptoms I have described, please get a fasting insulin test, not just a blood sugar test. Fasting insulin is one of the earliest and most sensitive indicators of metabolic dysfunction, and it is often not included in standard panels unless you specifically ask for it. The fifth hidden symptom is one I save for last because it is the one that surprises people the most, and that is increased frequency of infections, particularly urinary tract infections, yeast infections, and skin infections that keep coming back. When blood sugar is elevated, even at subclinical levels, it creates a biological environment that bacteria and fungi absolutely thrive in. Glucose feeds pathogens the same way it feeds your cells. When there is excess glucose circulating in your blood and in your tissues, microorganisms that cause infections have more fuel to grow and multiply. Additionally, high blood sugar impairs the function of neutrophils, which are the white blood cells responsible for finding and destroying bacteria and other invaders. So you have two problems happening at the same time. There is more food for the pathogens and a weaker army to fight them. This is why recurrent yeast infections, particularly vaginal yeast infections in women, are one of the most common and most ignored early signs of blood sugar dysregulation. A study published in the Journal of Clinical Endocrinology and Metabolism found that women with undiagnosed type 2 diabetes were more than 3 times as likely to have experienced recurrent yeast infections in the previous year, compared to women with normal blood sugar, 3 times more likely. And yet this connection is almost never made in the primary care setting. Women are treated for the infections repeatedly without anyone asking the obvious question about what might be making those infections so persistent. The same logic applies to urinary tract infections, which are also more common and more severe in people with elevated blood sugar, and to skin infections and folliculitis, which are infections of the hair follicles that appear as clusters of small red bumps most commonly on the thighs or buttocks. If you or someone you love has been struggling with recurrent infections of any kind, and the root cause has never been fully explained, please add a blood sugar and fasting insulin panel to the list of things to check. Now I want to spend a moment on the things that make all of this worse, because it is not enough to know the symptoms if you do not also know what is quietly accelerating the damage in the background. The first thing I want to warn you about is something that is in almost every refrigerator in the country, and that is flavored yogurt. I know it is one of the foods that has been sold to us as a health food for decades. The packaging shows athletes and fresh fruit and words like live cultures and probiotic rich. But most flavored yogurts, even the low-fat versions, contain between 20 and 30 grams of added sugar per serving. To put that in context, that is roughly the equivalent of eating 6 teaspoons of sugar in one sitting. And because the sugar is combined with a relatively small amount of protein and very little fat in the low-fat versions, it hits your bloodstream very quickly, creating exactly the kind of spike and crash cycle I described earlier. This does not mean all yogurt is bad. Plain, full-fat Greek yogurt with no added sugar is a very different product with a very different effect on blood sugar. But the flavored versions that fill the dairy aisle are doing real damage to millions of people who genuinely believe they are making a healthy choice. This was not their fault. They were marketed to, and they deserve to know the truth. The second thing I want to warn you about is chronic sleep deprivation, because most people do not understand just how powerfully sleep affects blood sugar. A study published in Annals of Internal Medicine found that just 4 nights of sleeping, 4 hours per night, was enough to reduce insulin sensitivity by up to 25% in healthy young adults. 25% in 4 nights. When you do not sleep enough, your body produces more cortisol, which is a stress hormone that directly raises blood sugar, and it produces more ghrelin, which is the hunger hormone that drives you toward high carbohydrate foods the next day. So, poor sleep creates a double hit on your blood sugar regulation, both directly through hormonal changes and indirectly through the food choices it pushes you toward. If you are someone who regularly gets fewer than 6 hours of sleep, and you are also experiencing any of the 5 symptoms I described today, sleep is not a separate issue. It is part of the same picture. The third warning involves something I see being pushed very aggressively on social media right now, and that is the trend of replacing meals with so-called healthy fruit smoothies. A single large smoothie made with 2 cups of mixed fruit, a banana, and a splash of fruit juice can easily contain 60 to 80 grams of carbohydrates with almost no fiber, no fat, and very little protein to slow absorption. That is a blood sugar catastrophe in a glass, regardless of the vitamins it contains. When you eat a whole piece of fruit, the fiber inside the cell structure of the fruit slows down how quickly the sugar enters your bloodstream. When you blend it, you destroy that structure and turn the whole thing into a rapid delivery system for glucose. I am not telling you to avoid fruit, I am telling you that blending it into a liquid and drinking it on an empty stomach is a fundamentally different metabolic experience than eating the same fruit whole. If you love smoothies, add protein. Add healthy fat like avocado or almond butter. Use vegetables as the base and add fruit in small amounts rather than as the primary ingredient. That one change can make an enormous difference. Now let me bring everything together and talk about what you can actually do starting today, because information without action does not help anyone. The first thing you can do today, and I mean literally today, is to eat your meals in a different order than you probably do now. Research from Weill Cornell Medical College, published in the journal Diabetes Care, found that eating vegetables and protein before carbohydrates at the same meal reduced blood sugar spikes by up to 73% compared to eating the carbohydrates first. You do not have to change what you eat. Just change the order. Start with the salad, the vegetables, the chicken or fish, and save the bread or rice for the end. That is a free, immediate, and powerful intervention. The second action is to take a 10-minute walk after your largest meal of the day. Not a long walk, not an intense workout. Just 10 minutes. A study published in Sports Medicine in 2022 found that a short walk taken within 30 minutes of eating reduced post-meal blood sugar spikes by nearly 30% compared to sitting. Your muscles are the largest glucose sink in your body. When you move them, they pull glucose out of the bloodstream and use it for fuel, which takes that burden off your pancreas and stabilizes your blood sugar naturally. The third action is to ask your doctor specifically for a fasting insulin test at your next appointment. Not just a fasting glucose, not just an A1C, a fasting insulin level. As I mentioned earlier, insulin resistance begins years before blood sugar rises to abnormal levels. A fasting insulin above 10 microunits per milliliter, even with a completely normal fasting glucose, is a significant early warning sign that the system is under stress. Most standard panels do not include this test. You have to ask for it by name, and you deserve to have that information. The fourth action is to audit what you are drinking. Many people eat a reasonably balanced diet but consume enormous amounts of hidden sugar through juices, sweetened coffees, energy drinks, and flavored waters. A single large sweet coffee drink from a popular chain can contain 50 grams of sugar or more. Switching to water, plain coffee or tea, or sparkling water with a slice of lemon for flavor is one of the single most impactful changes you can make for your blood sugar without changing a single meal. The fifth action is to prioritize sleep as aggressively as you would any medication. Set a consistent bedtime. Make your room dark and cool. Avoid screens for 30 minutes before bed. If you struggle with sleep quality or suspect you have sleep apnea, which is very common and very underdiagnosed, and which directly worsens insulin resistance, please bring that up with your doctor. Treating sleep apnea has been shown in multiple studies to significantly improve blood sugar control in people with type 2 diabetes. I want to end by asking you something directly because I want this video to lead to a real change in your life, not just 30 minutes of interesting information that fades away by tomorrow. Which of the 5 symptoms I described today have you been experiencing and quietly explaining away as something else? Leave your answer in the comments below. Tell me specifically which one surprised you the most. And if any of this sounded familiar, I want you to think about one person in your life. A parent, a sibling, a close friend, someone who has been feeling tired or moody, or who keeps getting sick and cannot figure out why. Share this video with them. You might be doing them one of the most important favors of their life. My name is Dr. James Hargrove, and I have spent over 20 years working with patients who were failed by a system that waited too long to give them the information they needed. This channel exists because I believe you deserve to know what is happening in your own body before it becomes a crisis. Every video I make here is about giving you that knowledge in language that actually makes sense, so that when you walk into your next appointment, you know exactly what questions to ask and exactly what tests to request. I genuinely care about the people who watch this. I want you to feel better, to have more energy, to know that what you are experiencing has an explanation and a solution. Please make sure you are subscribed so you never miss a new video. And remember that everything I share here is educational information meant to help you have better conversations with your healthcare provider. This content is not a substitute for personalized medical advice. And if you have concerns about any of the symptoms we discussed today, please speak with a qualified medical professional who knows your full history. Take care of yourself. You deserve it.